I'm Roy Baker. I'm the IT Training Manager for SCW. I've been in NHS for about 10 years now. Previous to that, within training for 27 years. I've also worked for SCW for about just under 5 years now. Really enjoyed my time here at SCW. Like everybody else, I saw an advert and I applied. I was working away quite a bit and I wanted to work more locally. I live in Oxford, and so there was a local position at my local trust for an IT trainer, and I decided that yes, I'd like to sort of get into the NHS. NHS was an area that I was quite interested. I liked what NHS does. I like the fact that it's an organisation which is a proud organisation, and joining it sort of made me proud. And as I said, I joined within the trust as an IT trainer and worked my way through to an IT training manager position at another trust in central London before moving to SCW as their IT training manager, looking after primary care rather than secondary care. It's the people that work in the NHS, are dedicated people. They work because they want to work and they want to do well. But at the same time, there's opportunity for people to progress within the NHS, so that's key for me, is making sure there's a career path for people, and that's what I try to do. Is I make sure there's a career path for my staff. So when we employ people, we want to nurture their development, we want to nurture their careers, and help them develop into the best they can be. They get an opportunity. They get support, from a perspective of management, from a perspective of the team. They get constant support. Everybody helps each other. They all try to support each other in all the things that they do. It doesn't matter whether it's training, whether it's whether they're working in a service desk or working in the actual strategy and transformation teams. They get support from their management team and constant support from their colleagues and their peers to sort of do as best as they possibly can. And it challenges them as well, because obviously it needs to be challenging to make the job interesting. Come in with an open mind. Come in using your skills that you've already learned, because obviously we need existing skills. Remember, always think about learning new skills and using those to help the NHS and to help your colleagues and your management, because at the end of the day, the NHS needs people. It needs people to help it progress. It needs new ideas. So yeah, come in with an open mind. When the pandemic hit, obviously as a training team, we were there to deliver training. Training as a whole sort of slowed down a bit, and my team was instrumental in helping out with the pandemic. We through the ambulance service, they wanted to recruit for the 111 service over 3,000 returning GPs, and my team helped support at very short notice. I mean, we set it up within 4 days, helping the actual GPs return using their and setting up how they would use their equipment. So they were sent a laptop, they were sent software, and we helped set up that software on their laptops. We helped set up their passwords so they could actually use their laptops, and we set up the idea that they were able to talk to patients fairly quickly to ease their burden of panic and help them through the pandemic, and to just make sure that they knew what they needed to do if they had any symptoms, whether COVID or not. Real life work experience, paid work while you're learning, and you'll have support and guidance from both management and from your team. Hi, I'm Roy Baker, and this is life at SCW.